Hi, my name is Jillian Janess, and I will be introducing you to our presentation today. The culture that we are going to be talking about today is the Hmong Heritage, and the communication device is the Langogo device. My first thing to do is introduce you to Hmong Heritage, and then I will go on to tell you about 5 healthcare facts about this population and how we can assess them to better work with them and make them feel comfortable and educate them on healthcare topics. Brooke will then go over traditional foods and their diet, and Peyton will go over the Langogo communication device. To start off, I am going to introduce you to the Hmong people and their background. The Hmong people are from many Asian countries, but right now they do not have their own country. They originally came from southern China, but were persecuted and forced to flee to other countries. The Hmong are comparatively recent immigrants to the U.S., having only arrived within the past 40 years. Because of their affiliation with the Americans during the Vietnam conflict, the Hmong were persecuted by the communists following the fall of Saigon in 1975, and many were forced to flee to refugee resettlement camps in Thailand. Over the next 2 decades, hundreds of thousands of Hmong refugees were resettled in the U.S. and other countries. Over 260,000 Hmong people live in America. The number of Hmong people has doubled since 2000. So for my first fact, there is a generational gap between older and younger Hmong people. And we need to make sure that we're assessing the beliefs of our Hmong patients about health and disease prevention. Older and younger Hmong people have varying beliefs about healthcare. We need to ask them what they believe because it can differ between generations. And as a result of their differential experiences and histories, a generation gap exists between younger Hmong individuals born and raised in the U.S. and their parents and grandparents, many of whom emigrated as adults. There's substantial generational differences that can be found in education, literacy, health beliefs, as well as knowledge of Western medicine. For my second fact, it is that there is typically a male head of household in Hmong families. Traditional Hmong society is clan-based, patriarchal, and collectivist, characterized by a strong kinship ties and tendency for the well-being of the clan and family to take precedence over the individual. Decision-making within families is collective and hierarchical, with the male head of household having a great deal of influence over decisions for members of the household. You need to assess for family dynamic by asking who takes precedence in important decisions for the family. When communicating care plans with Hmong patients, have the male head of household be included in conversations about decisions in the family member's plan of care. This can be very important when trying to make big decisions and plans of care, and not just relying on you have to rely on telling the whole family and making sure that everybody is able to be a part of this decision. The Hmong follow an animist tradition and believe in the influence of spirits in all aspects of life. We need to assess for and respect beliefs of supernatural influence over illness. Assess by asking about their supernatural beliefs and values and how it impacts their healthcare. They tend to think of health holistically in terms of integration of the body and its souls. While they recognize multiple causes of illness, those with protracted courses and debilitating symptoms are generally viewed as supernatural or spiritual in origin. And this can communicate to changes in care, such as needing a shaman or a spiritual route of care, and that can change the plan of care for your patient. Now, Hmong people do not seek out medical care until they are physically sick. We need to assess Hmong patients for beliefs about invisible disease. Ask about their beliefs and educate on invisible disease. And in the traditional Hmong view of an illness, an individual must be feeling ill or sick to seek treatment. There is no conception of an illness that could be developing invisibly within the body without causing symptoms. And This really impacts healthcare in Hmong people who have cancer because they don't find out until they are really, really sick. And if we can just educate them on finding the tumors or other symptoms of cancer or getting checked up regularly, then that can help prevent a lot of serious illness in Hmong people. Women in this culture tend to prefer women as nurses and doctors during physical exams due to modesty. You need to be sure to ask your patient whether or not they want a male or a female to help them with their care. Further, medical procedures involving reproductive organs tend to be especially problematic due to traditional Hmong values regarding modesty and views of the body as private. Consequently, Hmong women tend to be embarrassed and uncomfortable with the intrusiveness of a gynecological examination, particularly if it is done by a male physician. I feel like this can be really uncomfortable for a lot of different cultures, but specifically if you know that your patient is from Hmong descent, that you need to ask them whether or not they're comfortable with a male or a female doing their assessments or their procedures, or just overall, are you comfortable with me being your nurse today? That would be a very simple way to ask the question. Most Hmong will go to a shaman for help before they go see a doctor. When they are sick, they will either ask a shaman to heal them, or if they go to church, they will ask a pastor to pray for them. Or they will go and find herbal medicine before resorting to doctors. You can assess the Hmong needs for shamans or herbal health care. And you can explain that a shaman can visit them in the hospital and that you could evaluate which herbal medicines they can take while being cared for. This could be very simple, such as directing them to a shaman or having a shaman come visit them in the hospital, or with the herbal healthcare medicines, you can talk to the doctor. Hey, they're wanting to take this, is that going to be okay with their medicines? And just making sure that you're collaborating with what they want and making sure that that's safe for them to take. I want to say thank you, and I hope you learned some good ways to assess Hmong beliefs and comfort in healthcare situations. I hope that you can use these in multiple situations, not just with Hmong people, but with many different people from many different diverse populations. I think that this would be helpful for all of those. Now Brooke will tell you about traditional Hmong foods, and enjoy the rest of our presentation.